So first thing I want to cover is just, again, what we know about physical activity and cancer prevention. And I think Dr. Lee gave a really good talk on this, so I'll try not to rehash too many things, but I think it's good just to cover it again. So we have very strong evidence that physical activity can reduce the risk of breast cancer and colon cancer. And there's also more limited evidence that it can reduce the risk of a variety of other cancers. But one thing that I think is also important to point out is some of these other 11 cancers that there's less evidence for physical activity directly. There is a lot of strong evidence that obesity can increase the risk of these cancers, and we all know that physical activity can go quite a long way to reducing obesity. So I think, we can certainly say that all 13 of these cancers can certainly be affected by physical activity. So just to give a little bit more background about some of the cancers that are related to physical activity. In breast cancer, there are 230,000 cases diagnosed each year, and physical activity has been associated with about a 20% reduction in risk. So if you think about this large number of cases every year, that's a huge population that could reduce their risk of breast cancer and potentially lower the number of cases we have every year if everyone was participating in this vigorous activity or moderate activity. One thing that's unique about physical activity as well is that it can reduce the risk of both premenopausal and postmenopausal breast cancer, and can reduce risk in women who have a family history as well as those who don't. So, a lot of women are worried if they have a BRCA mutation that there's nothing they can do, they're, going to get breast cancer regardless. One thing they can do to reduce their risk is participate in physical activity. So I think it's a good message that we can give people that even if you maybe have a genetic enhanced risk, you still can modify your lifestyle to reduce your risk of cancer. And most of the studies have shown that you have the greatest reduction in risk with the vigorous physical activity. So, jogging, doing things where you, can't sing, as Dr. Lee said. But even moderate activity, so even going for a walk can help reduce your risk. So even if you're not in the best shape and you can't go out and run a marathon, you can still do something to reduce your risk from cancer. And similar studies have shown things like this with colon cancer. So there's about 100,000 cases of colon cancer each year, and physical activity has been shown to be associated with about a 30% reduction in risk. So again, that's a huge population of colon cancer cases we could reduce if people were physically active. Physical activity has also been associated with a lower risk of developing polyps, which are generally thought to be a precursor to cancer. So that's sort of even a more measurable kind of reduction from physical activity. And again, just like breast cancer, the more physically active you are, the greater risk reduction you can see. But doing anything has been shown to be associated with some sort of reduction in risk. And then I won't belabor this too much, but as we know, obesity is associated with a variety of cancers, and being physically active is one of the most important ways to reduce reduce obesity, particularly in children. And this leads to not only reduced obesity in the children themselves, but leads to sort of a lifetime of physical activity and reduced obesity in adulthood. And while we're talking about cancer for the most part today, I think it's also important to point out that physical activity has a variety of positive health outcomes. So it can certainly reduce your cancer risk, but it can also reduce your cardiovascular disease risk, which is the leading cause of death in the US, and as well as can increase mobility and improve quality of life for everyone regardless of their cancer status. So here are just some of the physical activity guidelines, again, that you've seen from a few of the speakers. For adults, the main guidelines are to avoid inactivity when you can and get at least 150 minutes a week of moderate or 75 minutes a week of vigorous activity. And if you want to see even more health benefits, then you can increase this aerobic activity to twice. So try to get 300 minutes of moderate intensity or 150 minutes of vigorous activity. And also to include muscle strengthening activities twice a week. And then for children and adolescents, as we've seen, it's to get 60 minutes or an hour of activity daily, and to include aerobic activity as well as muscle strengthening and bone strengthening activities. And to make sure that for children, the activities are age appropriate. So as we've heard, a 6-year-old and a 16-year-old aren't going to be able to do the same activities, and they're not going to enjoy the same activities. So make sure they're age appropriate and enjoyable, and offer a variety of different things for the children to do so they don't get bored and they can really find something that they can love and support a lifetime of physical activity. Unfortunately, most of us, children and adults included, aren't meeting these guidelines on a regular basis. So from the 2011 Youth Risk Behavior Surveillance Survey that was mentioned earlier, less than 30% of the students were meeting this hour of physical activity a day when they were asked about the 7 days prior to the survey, and only 31% attended a PE class every day. 58% did report playing on at least one sports team, but that still leaves a huge gap in the number of children that aren't participating in sports at all. And when we look at adults, we're doing even worse than the kids. So only 20.6% of adults are meeting the physical activity guidelines. And these numbers were even lower for women and for older adults. So before I go into some of the recommendations on what to do, I wanted to give you a little bit of an overview of what some of the state and tribe and territory cancer control programs are currently doing. So we did sort of a broad look at the state cancer plans, and we looked for information in the state cancer plans about nutrition and physical activity. And so looking at the state cancer plans gives us sort of a high-level overview of what states might be doing in nutrition and physical activity, but it is certainly by no means a comprehensive look at all the activities that we're doing, but it does kind of give us an idea of, is this topic on the radar of the states? So we looked at all the cancer plans we had available that spanned years from 2004 to 2014, and we searched for terms like nutrition, physical activity, exercise, healthy eating, healthy foods, as well as a long list of others. And then we categorized the plans, either they had information about, there's a link between nutrition and physical activity and cancer risk, or if they went a little further and said they had goals to improve these behaviors, so maybe they said we want to increase the number of children that are meeting that 60 minutes a day. And then finally, if they had actual strategies to improve these behaviors, change environments, or change health systems. So maybe not just saying they want to make sure kids are getting 60 minutes a day, they say they want to make sure kids are getting 60 minutes a day by increasing the number of schools that have PE classes offered, or increase the availability of, trails and bike paths and things like that. So on this slide, I don't really worry too much about the details. I just wanted to show it. It kind of gives a broad overview of what states are and are not working on nutrition and physical activity in relation to their cancer plans. So the blue shading just shows you the levels of obesity in the states. So the darker the color, the higher levels of obesity. And the hashed lines showed whether or not these plans had any information about nutrition, physical activity, and obesity. And we wanted to see if, states with high burdens of obesity also had this kind of information in the plans, since presumably they have the highest burden. And what we saw is that generally, yes, states with higher levels of obesity did have it in the plans. And you can, certainly hard to see on the map, but Delaware is certainly one of the states that has nutrition and physical activity in their cancer plan. But there still are a decent amount of states that have no information about nutrition and physical activity in their cancer plan, even though this is a really, really important area for cancer prevention. So that's definitely something that we as CDC can try to work with state cancer control programs to make sure this sort of information is on their radar. So looking at sort of the categories of nutrition and physical activity strategies in the plans, the majority of states that had any kind of information in them had information around increasing awareness. So just getting, sort of the word out that nutrition and physical activity are important for cancer prevention. And then right next to that was school wellness. So trying to address, PE in schools, or increasing physical activity available to children in schools, as well as worksite wellness, and then a variety of things that are more targeted towards, outside of school or outside of work, physical activity and nutrition. And here, I just have some of the examples of the kinds of strategies the plans had. So if you look at, school wellness, states wanted to promote the amount of time that was required for physical activity during PE classes. So to make sure that, children not only are they required to go to PE, but as part of the PE class, they're actually up and moving and being physically active. And then something we've heard a little bit about from some of the other speakers are some of these community school agreements. So making school resources available to students in the community outside of school hours. And so from this, we decided it would be a good idea to put together some promising practices for physical activity. So this, the next few slides I'm going to talk about generally increasing physical activity in the community, and then after that I have a few more slides more specifically on increasing physical activity in a school setting. And this document here is available on CDC's website, and I have links to everything at the end of the presentation. So I'm kind of doing, a high-level overview with the slides, but you can actually get to the documents and get more in-depth information on your own when the slide set is posted on the website. So I think, one thing that is important to point out is there are legitimate barriers to physical activity that people face. Certainly as adults, we face a lack of time, and children in schools, they may have a lack of time because the schools are really emphasizing their, math, reading, and other subjects over physical activity, as well as there are safety issues. So if it's not safe for someone to, go for a run outside or for a kid to walk to the playground, that's not going to happen. Boring or not enjoyable if, students or even as adults, if we haven't had the chance to find an activity that, I think the computer may have just died. Yeah, all right, thanks. So as I mentioned, there are legitimate barriers to physical activity that adults and students in the community face, and they are things that we need to take into consideration when we're thinking about how we can address these problems. So next, I'm just going to go through some of the strategies that have been shown to work for increasing physical activity, and as I said, most of these are more for the community setting than necessarily a school setting, and you can find more information about these at the community guide website, as well as in the link to the document that I have at the end of the slide set. So programs that are really adapted to the individual have been shown to work. So usually these include things like goal setting and self-monitoring. So you want to meet so many steps a day, and you have some sort of tracker where you're monitoring the number of steps. And building social support for new behaviors. So a lot of things work better, like you said, if you have a challenge and all of you are trying to see who can get the most steps than just one person working on their own. As well as things that, teach behavioral reinforcement through self-talk or self-reward. Maybe, you tell yourself, I'm going to get to watch my favorite TV show if I meet my number of steps today. And things that teach people how to problem solve when, things come up in life and maybe you aren't going to be able to go to the gym like you expected, how you're still going to increase your physical activity in your life. Social support interventions in community settings have also been shown to help increase physical activity. So things that, build or strengthen or maintain these social networks are important. I think a lot of people really do need a buddy or a support group to keep themselves accountable and to make it fun and enjoyable. It's, a lot more easy to go out for a long run if you've got a running buddy than if you have to do it all by yourself. Community-wide campaigns can also help if they're not just like one billboard or one radio spot or something saying physical activity is important, but if they're, broad-based, so they're, maybe have some sort of media, but then there's also opportunities for physical activity and, events in a variety of sectors of the community. So maybe you have schools involved, you have faith-based organizations involved, you have the rec department involved. All of these aspects of the community working together can really enhance the ability to have behavior change. Enhanced school-based physical education has been shown to work, and this I'll talk more about in the next section, but basically these sort of programs just increase the amount of time that K through 12 students are getting this moderate to vigorous physical activity in their PE classes. So they have, strategies and lessons that do increase physical activity, and they do a variety of things like circuit training or other things to keep students engaged and keep fun up and engagement of the students. There's also, community scale projects. So, if we want people to be more physically active in the community, they really need a place to do this. So if people don't live close to recreation areas or close to sidewalks that they can use, it's going to be hard to increase the number of people who are meeting their physical activity requirements. So these are things that, more policymakers and other people can think about when they're making urban design and land use policies, to think about how these different policies are going to affect the people that live there. Connectivity of streets and sidewalks. So if you don't have enough, sidewalks and crosswalks and things like that, people aren't going to be able to walk to get to somewhere or go out for a run or walk to the playground if they don't have any kind of safe way to get there. And then other, aesthetic and safety aspects of the environment. So, if everything in the playground is broken and, fences are broken and things, it's not going to be a very nice place for the children to play, and parents probably aren't going to think it's very safe to let their kids go out and play there. And, prompts for stair use, I think this works more with adults. I think, I don't know if it was Irene maybe that mentioned the, putting a sign next to the stairs, say if you walk up the stairs, you're going to burn this many calories versus, taking the escalator or the elevator. I think it can motivate people just a little bit to make small changes in their daily lives to increase their physical activity. Again, there's also sort of the street scale policies, so making sure there's lighting, so in the winter hours when there's not a lot of daylight after school or after work, or just at night in general, people want to feel safe when they're outside walking or running, and increasing street crossing safety and traffic calming approaches. So I don't know if they have these here, but in Atlanta they've started to put all these extra pedestrian walkways on some of the busier streets where they hit it, and then just in the middle of the street a stoplight comes up while the pedestrian walks across the street. And so it's not like just, hey, please stop for me. Like, the cars have a stoplight while the pedestrians walk across, and the stoplight is just for the pedestrians. It's not for cross traffic or anything like that. So it really helps people be able to get around safely. And then thinking about building codes and roadway design standards. So maybe, certain roads always have sidewalks built with them or have bicycle lanes designated. So there's in sort of the base, whenever anybody's building a new street or, new development, they have to incorporate these sort of things to get their permits and get their project going. It's also important to create enhanced access to spaces for physical activity. So, making walking trails in the parks, making signs so people know where they can go and how long the trails are, building exercise facilities or providing access to existing facilities. And some of this can come with some of the community school agreements that have been mentioned. If a school has a gym or has like a running track, making that available to the community before and after school, so that not only the students but their parents and other people can come and exercise at a facility that's close to their home. And then just for transportation and travel policies, so making these pedestrian and bicycle networks so you can actually get around the city on foot or on bike without having to worry about if you're likely going to get hit by a car. And then having public transit systems, because it shows that having public transit, there's actually a lot of active walking sort of in that, it's called the last mile to your destination. So if people are using public transit, they're going to get a lot more activity when they're walking to the transit hubs and walking from their stop to wherever they're going. But it can't be an insane distance that they have to reach. It's got to be something reasonable, and then people are likely to use it and get more physical activity that way. And then clinicians also have a role to play in this. So healthcare professionals, can certainly counsel their patients about why physical activity is important. It's got to come from multiple areas, and doctors certainly have a role to play in reinforcing physical activity, not only in adults, but pediatricians reinforcing it with their patients and the parents of their patients as well, to help everyone understand why this is something they should put the effort towards. And professional organizations can encourage counseling as part of routine care and, offer those continuing medical education credits and things like that, so that those providers can know what they should be talking to their patients about. And the United States Preventive Services Task Force does encourage physical activity counseling for anyone 6 and older with obesity, but I think, as we get more and more evidence of this, I think it's important for everyone to get this kind of counseling. Okay. All right, so the next few slides I'm going to talk about strictly, so physical activity in a school setting and physical education classes. And this is sort of a broad overview, so the document that all of this information is from is available at a link at the end of my presentation, and it goes much more in depth to all of these topics. And the document also covers early childhood education, which as a mom of a 2-year-old I found very interesting, but I thought maybe for time I wouldn't include in this slide set. But it's there if you work with that population and want more information. So again, enhanced school-based physical education is a proven way to increase physical activity in students, but to be an enhanced school-based physical education program, it needs to have a well-designed PE curriculum and provide staff with appropriate training. So, you can't just say, we need kids to be more physically active. You really need to have the curriculum and the training in place so that that can happen. And it's also important that you can combine this with other school and community-based interventions so that PE is not this standalone, the only source of physical activity in children's lives. So, as was mentioned before, include health education about physical activity. So why is physical activity important? Why should we be doing it to the students, as well as educating parents and teachers and everyone else in the community why physical activity is important? This is something we want to foster in our children and in our own lives. So most importantly, all students should have the opportunity to learn about physical education. So all students, for a quality physical education program, ideally all students would be required to take physical education from kindergarten, through high school, and get at least 150 minutes a week in elementary school ages and 225 minutes a week at the older grades. And also one thing that's important is that the physical education class size be consistent with other areas so that you're not expecting one PE teacher to be able to teach 100 students when you only expect the math teacher to teach 25. They really need to have the kind of class ratios where the teachers can interact with their students and facilitate their learning. And then also, having qualified physical education teachers, providing developmentally appropriate programs. So giving teachers the training they need, and then making sure that the curriculum for the different students, that the curriculum for the elementary school students is different from the middle school students, is different from the high school students, because they all have different needs. And certainly making sure, there's adequate equipment and facilities. So if it's a, class on basketball, you can't have just, one ball for 100 kids and expect everyone to be able to learn the same, all the different skills that you need to play a full game of basketball. As far as appropriate instruction, make sure it includes all students so that you're not just targeting the elite athletes. Students all the way down to the least coordinated kid in the class can get some sort of benefit out of their PE class. And giving maximum practice opportunities, so it's not all just let's sit down and learn the rules. It's actually get out, play the game, practice running, whatever the activity is. And ideally that should be at least 50% of the instructional time. And that can be accomplished by having well-designed lessons for the students. And then also having, every other class has homework, so maybe this could be homework, students actually enjoy. Having out-of-school assignments to support what they're learning in PE class so that it's not, we just do it in class and then forget it and sit and play video games, all the time while we're home. And then also one thing to sort of encourage a lifelong enjoyment of physical activity is not to use it as some sort of punishment. So not to say if, everyone doesn't stop talking, then everybody's got to run 2 laps, or, or converse, teachers saying if everyone's not good, then we're not going to have recess today, or something that, physical activity and physical education is a class the students take because it's important for their health and their education. It's not a privilege or a punishment to be, given out or taken away. And then also to assess, the programs, to make sure things are working for the students, for the teachers, getting the outcomes you need and seeing if they're, problems that arise or anything that could be improved to make the program even better. PE should also have meaningful content, so curriculum for, from kindergarten to 12th grade should build on each other, as well as meet, state and national standards, and should include a variety of activities that aren't all just aerobic or all muscle strengthening, so students can experience a variety of different exercises to really work on their physical, emotional, and mental development. And then also, adding the education component so kids understand, what they're doing, why they're doing it, why it's important, and how they can improve. And really giving students this opportunity to just, engage in a variety of activities that maybe help them work together, or there's some activities where maybe they're working on their own, but giving them lots of options to really make sure that they're learning things in PE that can help them improve their physical activity, not just while they're, small children, but throughout their lives. And then assessment is really important. You just have to, once you put a program in place, you really have to see, is it working the way we thought it was? Are we meeting the goals that we set? Are we meeting the national standards that we set for physical education? And you can bring in outsiders. It doesn't have to just be the school itself, so other stakeholders in the community, as well as parents and children, to see how the program is really working for your school. And in addition to just the PE classes that are part of the school day, physical activity before and after school is also very important, since children are supposed to get 60 minutes of physical activity a day, but they're most likely not going to get all of that in a PE setting. In addition, it gives them an opportunity to practice what they've learned in the class, as well as become, more prepared for learning. So if they've been able to get out a little bit of energy at the beginning of the day, they might be more prepared to concentrate on their math lesson or science lesson than if they, were just sitting around watching TV before school and then sitting in homeroom and then have to go straight to their other classes. And then it also gives students an opportunity to identify activities they might enjoy long term. So things like, biking or running or soccer that they might want to do as adults instead of just activities that they do while they're in school. And just some examples of before and after school activities could be, like walking, biking to school programs, if those are feasible, if there's safe ways for children, to walk or bike to school. Physical activity clubs, so maybe this isn't, the elite athletes, but just, kids who like to play soccer or tennis or basketball, getting together and playing more informal games, as well as just, informal play. So just having the playground open, having teachers available to supervise so that kids can play on the playground before and after school. And as well as in, working it into these school-based childcare programs. So a lot of kids are in aftercare because their parents, work later than school hours. So maybe incorporating into that, there are certain days that we do this kind of physical activity, or, days we, do go to the park or things like that, as well as interscholastic sports, having opportunities for children to participate in school sports both before and after school. Recess is also a very important part of increasing physical activity during the school day. But for recess to really be a good resource is that the students need the opportunity to be physically active, so they need age-appropriate equipment, and they can benefit from having adults to supervise and encourage them to be physically active. So there's a group of teen girls just standing over in the corner, chatting. Maybe there's a teacher who can encourage them to, walk around while they're talking instead of just sitting down and being sedentary. As well as provide sort of semi-structured activity. So maybe there's a jump rope station, there's a basketball station, there's a four square station. There's things for children they can just do without having to figure it out on their own. You can also incorporate breaks into the classroom, so taking stretch breaks, marching in class, jumping with a rope, things like that. And then integrating it into lessons, so maybe young children, if they're learning to count, they can learn to do some activity so many times. And then incorporating breaks outside the classroom for older students, so maybe in between class changes there's extra time for physical activity, or during lunch there's the availability of the gym or other things that, students can take opportunities of the little bit of free time they have to increase their physical activity. So to sum up, I think we're all very aware by now that physical activity is an important way to reduce cancer risk. And even though adults are the most at-risk population for cancer, increasing physical activity in children really can set them up for a lifetime of physical activity and reduce their risk of being obese as adults and increase their chance of being a physically active adult, which will ultimately reduce their risk of cancer. And many state programs are already promoting physical activity as a means of cancer prevention, and I think it's certainly something that's going to remain as a very important priority for cancer prevention here. And at CDC, we do have a few resources that people can turn to increase physical activity in community settings and school settings. And so here I just have a list of some of our resources. So the first one, it's got a jargony name, the Library of Indicator and Data Sources, but it's basically just our list of evidence-based strategies for primary prevention, and a lot of those include physical activity strategies, as well as there's the Promising Practices brief that I talked about earlier, and our Healthy School Guide, which includes much more in-depth information on quality physical education programs than I was able to cover here. And then the Community Guide, which has a lot of resources for community settings. And this is my email address. If you want to contact me, or if you need anybody else at CDC, I can try to get you in contact with them as well.